I would say my kids, they did crave, like they wanted a McDonald's fish sandwich. Sleep is definitely a big thing, as in the fitness is recovery. Stress, we all stress. So if somebody tells me that they're not stressing, they pretty much are lying.
Welcome to the Five Rivers podcast. I'm Dr. Sumeet Arora. I'm an American board certified pediatric endocrinologist. I'm working at a tertiary care center and leading the division in that department. I have a very special guest here today, Amber, and she is an excellent person. She is a fitness expert, a nutrition coach with a 17 years long history of training a lot of people from all age groups from 8 years to 80 years. And I will let Amber introduce herself. She is also a mother of five, and she's currently doing her master's in public health. Welcome, Amber.
Thank you. Thank you for the introduction. Yes. Definitely love being in the fitness industry. Like you said, I have started studying my master's in public health. Just want to take it a little bit further with diving into a little bit more behavior changes in people and just understanding a little bit more statistics on certain things in my community.
Amber, we did talk about the cultural aspect of it. So let's dive deep into the doctor patient relationship of how the community feels and the access to doctors. Is it limited, or what are your thoughts on that?
I think there's a big barrier between African Americans and the healthcare system. We have been tested for different types of diseases. There have been, like for my grandmother's generation, like they don't go to the doctors because sometimes they believe that once you go into the hospital, you won't come out. So now going to the doctor is like, all right, if I have something, then I have it. Let everything naturally just take place. If it's my time to go, it's my time to go. And that's really with the older generation. And they may have some issues with the doctors too, being a little bit younger than them. So there's different barriers that play a big part of us going to see the doctor and getting checked out for these chronic illnesses.
What do you think would be something that could break that barrier? Anything um, for our listeners that you would suggest that that is going to break that ice into, like, overcoming the thoughts that okay, you need to get tested, we need to get that screening done, so that we're timely detecting that okay, maybe we have a situation where we're just pre-diabetes and we can do something about it. So what is it that you would suggest that yes, let's break the ice, let's take that one step forward?
I feel like when we see more people that looks like us, far as African Americans, if we see more health providers that look like us and they can educate us, then we have a more of an opening listening ear and to say, hey, okay, maybe I do need to go to the doctor. And even if they have like some health fairs to go into the community and also with the people that look like us, to educate us a little bit more, then I feel like that would be a big opening, like the door for us to, or initiative for us to go in and see the doctors and get these type of checkups that we need.
Would you suggest that okay, more people talking about it, more African Americans talking to different people about it, say for example you're here in this podcast talking about it, will that also play some role in the acceptance of yes, there are
Uh,
people who are there to help and
Yeah, I
do
think so.
something?
Even if it's just like planting the seed, I think it's a good thing. This, just to do. Like the seed may not flourish, but if I plant the seed, somebody else can come in and water it, and somebody else can come in and give it a little sunlight, and then eventually they'll come up and sprout and like, hey, I need to go to the doctor.
Yeah, so nicely put. So because we know that if we have a higher risk, and then we take just one step forward to get screened in terms of getting just the HbA1c done timely. Sometimes with a higher weight, with a higher BMI, getting an HbA1c done on time and getting detected with prediabetes and taking those first few steps that are needed to go back to your normal state will really go a long way and in preventing the onset of diabetes. And we probably can catch that much earlier, because once diabetes sets in, there's also this data that once African American gets diabetes or pre-diabetes, it starts to worsen very rapidly. So then that part where we can stop it at an early age will really help the later progression of it as well. So that's a very important point, that we just need to water, we just need to plant the seed and keep
Yeah.
watering it, and hopefully things will move in the right direction.
Another thing too with the African American community is that we operate off of fear sometimes. Like, oh, this is this. Well, I need to go get checked out. So, like,
Hmm.
I have a question. So, is there anything in particular, like I've heard and read about, like if the back of your neck or anything and it starts to get dark, is that a good sign for you to go and get screened for diabetes?
Yes, I'm so glad that you brought that up. So yes, this is the darkening of the neck that is there around the darkening of the skin around the neck is the first one of the first signs of developing pre-diabetes. So what this is it's the fancy word of it is acanthosis nigricans, which basically means that this is a sign of insulin resistance. The insulin in our body is not able to work properly anymore. So that's, yes, one of the red flags or one of the first signs that yes, now we should go more quickly than before to get yourself tested, and to make those changes that are very necessary to act at an early age. Also, another one is the fat accumulation around the belly. So
Okay.
higher waist circumference or higher waist to hip ratio is also another risk factor to developing prediabetes or diabetes later on in life.
So, is it like the tire or is it just like a bloating?
It's both. So
Both. Okay.
basically,
Okay.
so the waist circumference is high.
Hmm.
Yes. Yeah.
Okay. Okay. Is there anything else that we should start looking out that's physically that
See,
we can?
so there are a lot of non-modifiable risk factors. So one is like we already are talking about ethnicity. So African Americans, Hispanics, Indians, we're all at higher risk of getting type 2 diabetes. Then we're talking about people who are born underweight, kids who are born underweight. Later on, they end up developing type 2 diabetes because they're evolutionary, or like during their fetal development, they were born to be small, but then if they had a very fast catch up after being born, their risk of
Hmm.
developing type 2 diabetes increases significantly. So that's number two. So people who have gestational diabetes, they uh, are putting, or let me rephrase this, kids who are born to mothers who had gestational diabetes are at a high risk of developing type 2 diabetes as well. So
Okay.
those are some non-modifiable risks. But again, the diet and lifestyle, the more processed foods that we're eating, the more sugar-containing beverages that we're drinking, again, those insulin spikes are so much, and that is leading to a lot of fat gain because of those insulin spikes. So then that risk is tremendous compared to like if you're not eating or drinking these kind of sugar containing beverages. So there is obesity, which is metabolically healthy, versus
Hmm.
obesity, which is metabolically unhealthy, which means you are overweight, but you're not that much at risk of getting all these complications of diabetes, high blood pressure, heart attack. But when you're metabolically unhealthy, this is going to happen soon, or it's already happened. So people, yes, with the darkened skin around the neck, the high waist circumference, those people are at a higher risk of being metabolically unhealthy.
So it's safe to say that all of this can start from the mother and what
Yes,
she's ingesting. So it starts pre-birth.
yes, yes. So there is much now that we know in terms of genetics and epigenetics. So genes are something that are there in the fetus, but what is the environment of the fetus is also
Mm.
programming them to what's going to happen in the future.
That's interesting. The environment within, and then once you come out, then still it's the environment.